Good morning and soon to be afternoon, everyone. This is Susan at AMSIS. We'll be starting in a few minutes, but you can take this time to make sure your audio and video is working. You can, if you'd like, in the question box, type in where you're signed in from. If there's more than one of you, we'd love to hear that too if you're watching with a group. And we will be back shortly, read some housekeeping notes and get started with the program. In the meantime, enjoy the slideshow. All right, this is Susan again. Now I can officially say good afternoon. Thank you for joining us today. If you're having difficulty with connection or sound, you may want to close programs and browsers as they can use up bandwidth. You'll notice a control panel to the right of your screen. This is where you'll be able to type questions directly to the moderator. You may type your questions at any time and they will be addressed by the moderator. A survey will be emailed soon after this event. Your feedback is both appreciated and requested. If you're not already an AMSIS member and would like to join, visit amsis.org for a list of benefits and more information. And now, without further ado, I pass it along to Dr. Catherine Verkstes.
Thank you very much. It is my pleasure to be here with you all today. Good morning or good afternoon, depending on where you're dialing in from today. My name is Catherine Verkstes, and I am Vice President of Clinical Advisory Services at GetWell. I want to thank you for joining me for what I think is a really important conversation. I have a lot that I'm going to cover today, so really I'm just going to jump right in. I have provided some objectives for you that you see on the screen today, and I won't read them aloud, but I want to let you know that kind of my goal is I want you to walk away from this hour with a better understanding of the prevalence of violence in healthcare today, a framework for how to address this challenge, and then having some concrete kind of tactical things that you can immediately do to prevent and mitigate the risk of violence and aggression against nurses and other healthcare workers. But before we dive into the meat of that content, I first need to share a little bit of background about who we are at GetWell and what we do. So GetWell is a technology company that was started by a patient. And so what I want to do is share his story, which begins about 22 years ago. Michael O'Neill, who you see on the slide here in front of you, was a 28-year-old law student at Georgetown here in DC, close to where I live, and had abdominal pain. So he went to the student clinic and said, hey, I've got this pain. And to be honest, he was sort of dismissed at the clinic. They said, oh, you've got a law student ulcer. They all get one, go home and be on your way. And he said, no, really, something's not right. Back and forth to the clinic until finally he landed in a hospital bed where he was approached by a team of clinicians who said, we found a tumor the size of an orange in your abdomen, and it's non-Hodgkin's lymphoma, which is a type of cancer. And then they walked away and left him there alone in his bed. And this was back in the day before there were cell phones or computers in our pockets, and he didn't really know what any of it meant. And so he turned to his nurse and said, hey, I'm not a clinical person. I don't know what this means. Can you help me? Is there something I can read or watch to better understand what's happening to me? And the nurse in that moment sort of shrugged and said, I wish I had tools like that, but I don't. And eventually someone said, well, we have some patient education videos. And again, you can imagine this is 22 years ago, wheeled out a cart with the big TV on it and probably a VCR and pressed play. And what played for him in that moment was a breastfeeding video. I'm not joking. This is a true story. This is what really happened. And for me in that moment, that would be the moment when I would sort of lose it. He, I think, was more composed than I would be, and he immediately jumped to action. And he, from that hospital bed, sketched out a business plan and said, "We're going to make this better for the next one up." And that is how Get Well started. Michael O'Neill's vision is really at the core of Get Well's purpose, and you can see that reflected here. Get Well aims to empower healthcare consumers, to support staff and clinicians, and improve the experience for all. So Get Well tools are designed to help patients play a more active role in their care. We build patient education materials, comfort, distraction, relaxation functions, all of that right into the hospital stay. Now, fast forward to today, Get Well extends this purpose that you see here into just about every smart device you can think of, and not just in the hospital, but across the entire healthcare journey. So outside the hospital, we have care navigation solutions that support veterans before and after episodes of care with virtual monitoring, patient-reported outcome metrics, check-ins. And then Get Well Loop, which you see bookended on the left and the right-hand side of this slide, is a patient care management platform with over 250 longitudinal care plans across 20 plus service lines, such as orthopedics and cardiovascular, surgery, oncology, gynecology. And these care plans can be deployed to prevent an acute care episode. They can help prep veterans for a procedure, and they can also support recovery post-discharge, as you see on the right. Now, in the hospital, so the hospital stay in that middle column that you can see here, Get Well Rounds Plus is a digital rounding experience and management system within the hospital that helps care teams service and address patient needs. So we can send text messages and surveys and then view that data in a dashboard that enables care teams to prioritize and quickly act on the most pressing needs. Get Well Inpatient is what you see to the right of Rounds Plus, and that does all the things I mentioned a moment ago. So patient education, entertainment, relaxation, and much more. I actually want to double click on Get Well Inpatient on the next slide, just to give you a sense of the breadth of all of these things that the system does. So you can get a sense of what those capabilities are here. And this is basically the smart room of the future. But one thing I want to call out is it's fully integrated with existing digital systems like Vista or Computrition, Vocera. It's like a very long list of things that we integrate with. And that means it helps address patient needs more efficiently and effectively, but it also streamlines workflow. So both within care teams and across care teams. Just to give you an example, if a meal tray is missing or if it has the wrong food, a request through Get Well Inpatient goes directly to Food and Nutrition Services rather than going through the nursing team. And the same is true for any department. For any request that's made, it goes directly to the people who are most equipped to support that request in the moment. So this puts more control in the hands of veterans and their families. And then it also takes the onus off the clinical care teams and removes some of that additional burden so they can then spend more time with patients doing patient care. So it's a win, I would say, for everyone, especially after these last few years when teams have been stretched so thin. Okay, so that is a very brief overview of what Get Well does and how we support healthcare systems. Before you joined or at the beginning of this webinar, you heard the instructions about if you have a question, if there's anything that you want to ask, you can do so through the GoToWebinar control panel on your right, and I welcome you to do so anytime during this hour. I want to hear from you if you've got thoughts or things that you want to get clarified, or even just comments. That's helpful to me. So, and I'm keeping my eye on the question panel. So if there's anything you want to ask. So I will pause right here because I've shared just a bit of an overview of Get Well. If you have any questions at all about what I've just shared, please just go ahead and type them in. If I see questions pop up, I'll go ahead and address them in the moment. Okay, so I've been talking a lot about veterans' health. I thought I would share this slide with you just to give you a sense of the size of Get Well's footprint in government health facilities. You can see that today, Get Well supports more than 13,000 beds in 70 VA medical centers, 5 of which are VISN-wide. And there are just a lot of amazing outcomes. I've shared just a sampling here, just to give you a sense, improving veteran satisfaction, staff responsiveness, readmission rates, CLABSI rates, length of stay, kind of the list goes on. So we're not only improving experience, we're also improving outcomes. But I would say core to Get Well's mission, in addition to the veteran experience, is what I call the human experience, which includes care teams and all staff really that are involved in the healthcare journey. And unfortunately, we are not starting from a normal baseline when it comes to care teams. I don't know what your roles are for all of you on the line today, but suffice it to say, you have something to do with healthcare, and this probably isn't news to you. The emotion that you feel on the right-hand side of this slide is still persists today, even kind of in this post-COVID world that we're starting to move into. So the clinical team that I oversee, consisting of registered nurses and physicians, has been hard at work focusing on how Get Well's patient engagement technology can also support the care team experience, which is a different way to think about it, or as you might think about it, the human experience. And that is because there is another deadly epidemic happening in healthcare right now, and it's not COVID-19. It's workplace violence. We've all seen these headlines. They are tragic and they are heartbreaking. And I'd give anything to say that the extent of the problem stopped here, but it's far more reaching than the big news headlines, with which I think most of us have become all too familiar. Point of care safety threats against healthcare workers have been on the rise for years and are occurring daily at a disturbing rate. So here I've shared the Joint Commission reported data that 57 nurses are attacked every day. That's 2 per hour. This is heartbreaking data to see, and I think this is the stuff that doesn't make the big headlines. This is the stuff that happens behind the scenes that most people actually don't know about. And the impact on caregivers is very real. It doesn't stop when they leave the hospital either. That stress doesn't just disappear. It follows them into grocery stores, bus stops, parking lots, And remember, as I showed in a slide a moment ago, the workforce is already overwhelmed and starting from a lower baseline of resilience. So it's not surprising that nurses are considering leaving the profession altogether. According to Becker's, you can see at the bottom left, that number is now up to 43%, which is a daunting figure. So as I look at this and think about all these slides I've just shown you a moment ago, the big question is, how do we break the cycle? Well, to answer that, I want to share a very quick story. I fairly recently flew on a Southwest Airlines flight. I travel frequently, and many of you probably know the Southwest model, which is an open seating model. And as we boarded the plane and found our seats, a flight attendant approached the person who was sitting in the row in front of me. He was in the window seat, and he placed his carry-on bag on the aisle seat, ostensibly to save it for someone else. And the flight attendant said, "Oh, hey, Southwest has an open seating plan and saving seats isn't allowed, so you'll have to remove your bag." And then she walked away to help another customer. She came back a few minutes later and saw that his bag was still sitting on the seat and said, "Look, I'm really going to need you to move that bag right now so someone else can sit there," as other people were boarding. She walked away again, came back a third time, and this time she was stern and direct. She said, "Sir, I've asked you to remove your bag. Are you going to comply?" He didn't respond. She repeated this twice and now had asked him a total of 6 times, and he did not comply. He didn't say a word, and he just stared back at her, sort of blankly. And as you're listening to this story, I bet you're already kind of a step ahead of me in predicting what happened next. If you guessed that he was escorted from the plane, you are right. That is exactly what happened. It took about 30 seconds. She picked up the phone, called security, and a security guard appeared like magic. And that individual did not fly on that plane with us that day. He was removed from the plane. And he didn't even act aggressively. He just didn't comply with what she was asking him to do. And as I was reflecting on this moment, because this is really where healthcare is different from almost all other industries. If a hospital patient behaves inappropriately, we still have to provide care. We don't have the luxury of removing the patient from the plane. So in order to create a safe environment in healthcare, we're going to have to take a unique approach, something different and probably much more comprehensive than what some of these other industries do, which is to say we don't tolerate it and you'll have to be asked to leave. And so at least part of that answer is going to be that we need technology and analytics to help us be smart and to help us to be fast. But that technology, of course, is only as good as our ability to intervene. And human intervention is always going to be part of that. So the real insight here is that if we're going to promote a healthcare environment that is safe, we are going to have to deploy a strategy that integrates high tech with high touch. And what I've done is created a little acronym that will help you remember the strategies that we'll need to do that. And you can see them in front of you. This is our AWARE framework. First and foremost, on the left, is to raise awareness, not only among patients and families, but even internally among healthcare leaders. Moving right, the W stands for warning signs. So technology can really help us here. If we can't remove the patient from the plane, well, then let's at least know who those patients are and where they are at all times. The second A is that, as I mentioned a moment ago, that information is only as good as our ability to act on it quickly. And it's not just minutes, it is seconds that can make all the difference. So we're going to need to position active responders in a way that enables them to act fast. And so that is our second A, active responders. The R is for real-time emotional support. And this not only applies following an incident, but also near misses or even just fears and concerns in general. We don't have to wait for something to happen, in other words, to provide real-time emotional support for those that are caring for patients in this environment. And on the right, E is for evaluating historical data in order to learn, get smarter, and mitigate future risk. So my plan for the rest of our time today is to show you how you can implement this framework through a mix of high-tech and high-touch strategies. Now, important to note, some of the tactics I'm going to share have nothing at all to do with get well technology. Really, my aim is to lead with insight today, give you some concrete ideas you can implement tomorrow, but do keep in mind that we'll need technology to augment those high-touch tactics. And of course, Get Well is a perfect opportunity to kind of illustrate what those types of examples can look like. Okay, so let's go ahead and dig right in, and I'm going to start with a high-touch tactic on the next slide. And the reason I want to start here is because I think raising awareness truly starts with leaders. You know, I hear this a lot in my work. You know, I'm a physician by training. I spent 15 years doing research at the advisory board where I led the Nursing Executive Center and the Clinical Best Practice Collaborative. And you often hear this phrase, oh, it's just part of the job. You know, dealing with difficult patients or aggressive or even violent patients or family members, you know, people, you hear that being uttered. And I believe that leaders have an opportunity to explicitly reject the notion that violence and safety threats are quote unquote just part of the job. And unless we make that abundantly clear, we will never successfully change that narrative. So we believe a critical first step is for leaders to elevate the safety of the care environment as a goal to the top of their organization's system-wide strategic plan. And on top of that, make it a key performance indicator for leaders at all levels. We've got to raise awareness for veterans and their families as well, right? So it starts with leaders, and then I think we need to make sure that everyone who walks through our hospitals and healthcare settings have that same awareness. And one way to accomplish that is through our Loop platform. So here's where I'm going to start to show you where technology comes into play. I've provided a reminder of what Loop is on the right that I introduced a little while ago. It's a solution that allows care teams to engage and monitor patients across different episodes of care through automated virtual check-ins. But let me show you what this can look like in practice. This is just a hypothetical example. This is James. James is scheduled for knee replacement surgery. And the day before, so he might be on a loop that's, let's say, 30 days long to make sure that he is prepared to be successful in his surgical procedure. And perhaps the day before his procedure, he receives this brief note. This, by the way, is a process that's powered by AI, but to James, it feels like a personal touch through his orthopedic surgeon with a request to just read new information that will only take a few minutes to review. And it turns out it's a reminder that James needs to discontinue all food and drink by midnight so that he arrives for his surgery on an empty stomach. And then there's also an option here for James to ask a question, and that function is also powered by AI, but it is actually supported in the background by a human navigator, so that if James actually asked a question that required a clinical response that the AI could not answer, then a navigator could elevate that question to an appropriate clinician. In this case, James doesn't have any additional questions, so he just clicks yes, I'm all set. And then here's where we can begin to raise awareness about hospital policies. This hospital uses language that highlights the goal of desired behaviors, so dignity and respect, while also explicitly calling out unacceptable behaviors and inviting James to a kind of pledge to be kind. Basically, this is an easy formal process, or a promise rather, so a pledge or a promise. Now, as you're looking at this, you might be asking yourself whether or not, this really makes a difference. And what's interesting is there's a surprisingly large body of research showing that time and again, those who publicly pledge to do something are more likely to follow through than those who don't pledge. It's really interesting. It's this kind of a small gesture, but actually research shows has an outsized impact in the end. What's interesting is we can also build this kind of language into the hospital stay. So this is a view of Get Well inpatient. And here you can envision, let's say a patient like James has had his surgery and is recovering from a hospital bed. And he could be viewing this from any smart device. It could be a TV, a tablet, or on his phone. And he sees that he has 2 new videos chosen for him to watch. And you can see that in that tile on the left there called videos picked just for me. And you see that little arrow or caret with the 2. So if he clicks on that and navigates through the system, we then have the ability to share messages that look like pop-ups. And here we show the same kindness pledge, and we wouldn't normally recommend showing this to James since he already responded to the pledge before admission. Just kind of showing you how this can look on the inpatient side, perhaps for a patient who wasn't on a pre-procedure loop. We can also raise awareness like this through screensavers. So these can be automatically displayed whenever there's a TV or a digital device that is idle or not being used. And that, you can imagine then, is something that patients' families will be able to see, whether it be from inside a patient room or somewhere else in the hospital or healthcare setting. And these types of screensavers, this is a relatively new function within Get Well, but what's lovely about these is we have several different types of screensavers we can play, and then we can actually customize these kinds of things to have them say whatever types of messages need to be communicated to patients or families. So just a few examples I've shared so far about kind of tactics for raising awareness, whether through digital technology or more low-tech signage. The key here is to clearly articulate policies about which behaviors are unacceptable and then which ones are encouraged. Okay, so that was our awareness. Our next step in this framework is to identify early warning signs to prevent escalation. And I'm going to start again with a couple of high-touch tactics on the next slide. So one of the things that research shows is that disruptive patients or family members often display minor aggressions and other warning signs before their behavior escalates in severity. In other words, there are things that are subtle that if we were to pick up on, we might actually be able to prevent that escalation. The problem, as you can imagine, is staff often don't report those incidents because they're kind of unsure what behavior warrants that type of reporting. And as a result, disruptive behavior often isn't reported until it's too late. So this is a practice that comes to us from Sharp Grossman Hospital, which is an acute care hospital in La Mesa, California. And what they did is develop a decision-making tool to help bedside staff identify and appropriately report disruptive behaviors. It's a fairly straightforward and simple behavior assessment tool, but by putting this in place, this organization enabled staff to better identify those early warning signs and intervene before that behavior escalates. And what's interesting is these behavior levels that you see here, behavior level 1, 2, and 3, correspond to a set of action steps, also categorized by level. And you can see those here. kind of the idea here is to clarify which behaviors warrant intervention, and if they do warrant intervention, what are those intervention steps that care teams should take to prevent those behaviors from escalating. I think what's really interesting is what you see on the right, the impact of this. So this one simple tool led to a 68% decrease in the number of staff injuries due to combative patients. Now, the question you might be asking is, like, could this information be captured digitally? And of course, the good news is our Rounds Plus tool has surveys that are fully customizable. So we can build surveys to rapidly assess workplace safety, kind of elevate areas of concern, and then take action. And so here you can see just an example of what the backend dashboard looks like that summarizes data, and then we use color coding to capture areas of concern. So red might be super high priority, we need to address this right away. Yellow might be something like a level 2. Green might be there's no problem, or a lower level area of concern. We also have the ability to push surveys to any mobile device. So for a hospitalized veteran who's feeling anxious or agitated, these kinds of touches can both identify those early warning signs and also intervene early before that escalation occurs. And here's an example of how that might look like in practice. In this case, I'm sharing sort of a brief questionnaire about things that a veteran might be feeling worried about. So, for example, having enough food or housing or transportation. And then you can see what an assessment might look like. It's got a simple slider format that makes it pretty easy to respond. You don't have to type things in, you can just slide to yes or no. And again, we can build surveys like this to surface just about any patient need. I'm using an SDOH survey, again, just as an example here. Okay, so one thing I do want to acknowledge before I go any further is that sometimes the root cause of aggressive behavior is cognitive impairment or confusion. And I think when that is the root cause, when that's the kind of the heart of the challenge, it can feel a little overwhelming, because in some cases like that, when the warning signs seem more obvious, we sometimes feel like we don't have any tools outside of pharmacology to mitigate those risks. Zinnia is one such tool that is specifically designed to improve dementia care experience. So you can see an overview here. Zinnia has over 200 evidence-based videos that help reduce anxiety, promote activities of daily living, and so on. This is something that we have built into the Get Well inpatient system. And the format is, kind of easy to navigate, and aims to provide a welcome distraction for a hospitalized veteran. So again, just another tool we can keep in our toolkit to address the different types of warning signs, and mitigate risk of escalation. Another one is a behavioral health offering that comes from a partnership we have with Swank. So some of our entertainment features, including feature-length movies like the ones you see here, have discussion guides. And these discussion guides are designed to kind of prompt healthy, educational discussion about difficult topics like bullying, and you can see the list of topics on the left that are all incorporated into just this one particular movie or discussion guide. So another kind of just an interesting, thoughtful, and innovative tool that we can build right into the system. Now, another strategy for addressing early warning signs is to connect patients and families directly to patient advocates. Get Well Inpatient enables veterans to directly access a patient advocate or request help with another need. And that, let me show you how that looks. So this is again from the veteran's view on a television or a mobile device from inside the hospital. And the feature I'm referring to is the one on the left, the tile you see on the left called Tell Us How We Can Help. So basically, if a veteran clicks on that tile, he or she can request any of these support services. As I mentioned a moment ago, they could choose patient advocate. It's not shown here, but spiritual and counseling is. In this example, there's an issue with room cleanliness that will be then sent directly to environmental services. So again, bypasses the nursing care team who are busy trying to provide patient care. And I think what's interesting is like sometimes when you need something, the most frustrating part is not knowing whether or not you've been heard. GetWell responds with a notification to let the requester know that someone will be there to help them soon. The other thing that's interesting here is while there's no promise for how quickly we'll be able to respond, every hospital can decide what is a reasonable amount of time and then can send another prompt back to the patient to double check to make sure that that request has been completed. And if not, they're able to say so, which can further escalate and prioritize their need. Okay. Now, another obvious warning sign, of course, is when a patient has a history of violent behavior. And so on this side is a solution that we call Signal. So GetWell Signal is a digital display mounted just outside the patient's room, and it can be configured to show any alerts or precautions that should be communicated before someone enters the room. And so if you tap on any one of these, you can then see more information. In this case, what extension you should call if you need an interpreter. One more note here. So given the obvious sensitivities of a digital display like this, is that you can also blind the patient's name. And you can see that at the top left under room 25, we've then blinded the patient's name. So this provides a warning for someone who walks in. If you had a code there for a history of violence, something like V on the previous slide we showed, that way someone knows before they go into the room what the risks are before they walk in. Okay, so we've spent some time now talking about how to identify early warning signs, and we've covered a number of tactics for proactively preventing escalation to aggressive or violent behaviors. But what if a situation does escalate, and it does happen? How should we position active responders to come to our aid? By the way, what does typically happen when we call for help? I know you can't answer me, but while I can't hear you, hopefully some of you just said the answer out loud. What happens when we call for help? Typically, we know the answer. It takes too long, right? By the time they get there, it's too late. The event has already occurred. All too often, that is the reality. When help is needed, responders can't get there quickly enough, and usually it's not just minutes, but seconds that count. And so we see two primary root causes of delayed security response, and you can see them here. The first on the left is simply geography. A security guard is in another part of the building, another wing, or perhaps even in another building altogether, somewhere across campus. And then the second is on the right, and that is that a behavioral health incident or a behavioral health issue requires a specialized response. In fact, an untrained response can actually make things worse and lead to further escalation. So I want to start with 3 tactics that are pretty high touch. These come again from advisory board. This was research that I oversaw during my time there, and we've been given permission to share these with you here today. You can see I've sourced the publication at the bottom. It's called Rebuild the Foundation for a Resilient Workforce. And if you're interested in more information about these tactics, I can point that publication to you. Starting on the left, I want to talk about security personnel. So typically, security personnel's primary focus during patrols is building security, right? Checking doors, locks, stairwells, lighting, and surveillance systems. And these are super important, but they don't protect staff from point of care safety threats that might be happening at the bedside. So Texas Health Presbyterian in Dallas-Fort Worth, Texas, took the concept of like hourly rounding and redesigned it for security patrols. They basically do an hourly rounding handoff with the nursing staff on every unit, so that they have a sense for where the hot spots are. So is there a patient that has a history of aggression or violence? Is there a veteran that has displayed some of those really early warning signs? And we want to make sure the security guard is positioned to easily and quickly respond. Now, of course, like it's interesting because the CNO told me, I remember when they were implementing this practice, she wasn't sure how security would take it. You know, how would they feel about rounding in that way? And it turned out they really loved it. They loved the collaboration. They loved being able to help. They want to be able to help and be there more quickly. So it was a real satisfier for both teams, both the clinical teams and the security teams. But I do want to acknowledge that security personnel are somewhat limited in their ability to intervene because, you know, they're great at assisting in behavioral management, but only clinical staff can administer chemical restraints or pharmacological or provide, you know, medical interventions when appropriate. So in the middle here, Valley Hospital, which is a not-for-profit hospital in Bergen County, New Jersey, embedded a rapid response team. And that team, they call it Code Atlas. So they call it Code Atlas, and these are people who are on staff across all ranks. Anyone can do it. In fact, the CNO herself at that organization was part of this Code Atlas team. And they respond in the moment to support staff when patients or family members have escalating behavior or need help. Really interesting practice. And then on the right, take that same concept of an embedded escalation, de-escalation team and make it more specific to train staff who are trained for behavioral health emergency response. So this one, they lovingly call it the BERT. So BERT stands for Behavioral Health Emergency Response Team. It's made up of staff with behavioral health and de-escalation expertise. And the team manages all escalating patients in acute psychiatric crisis across the organization. I think all three of these are best practices worth considering. Technology is amazing, and we simply can't do any of this without interoperable technology and good analytics. But as an executive leader myself at a healthcare technology company, I'm the first to admit that technology is reliant on human intervention. So we need to make sure that we are integrating those two things together. Okay, so that's high touch. How can technology position responders to reduce response time? And here, I think one-touch notifications are the key. These are built into Get Well Inpatient and can immediately alert entire units, floors, or facility of an incident or potential threat. And what I like about this that's different than an alarm is that it can provide specific instructions about what people should do in a particular emergency. So in this case, the receiver of this notification is told to stay in the room and be assured that help is on its way. And unlike alarms that sort of just leave, you know, when they stop, when they're all over, you're kind of left wondering, well, is it safe? What's happened? Is everything okay? This notification can update people when the safety threat has been removed and then it's safe to go back about your business. So, you know, just a really thoughtful thing that you can do without any time wasted, right? It's a one-touch type of a system. Another cool feature of Get Well Inpatient is the ability to integrate real-time location systems, so also called RTLS. Not only does RTLS provide information about where caregivers are during any moment in time, so we can actually determine their exact location should an incident occur, but it also has the added bonus of clarifying for patients who exactly just walked into their room, because that person's name and photo will automatically pop up on the screen in front of them, whatever they're watching, right? They can see when someone walks in. And I would say in the age of masks and other PPE that makes it hard to see faces, this actually becomes a really helpful communication tool. As an aside, you can view your whole care team within Get Well Inpatient. So there is sort of a whiteboard function. You can see a history of who has come in and out. You can see that on the right. And then in the middle here, veterans and families can leave questions that they have for the care team. And I think what's interesting about this one is this can be built, this kind of whiteboard function can completely replace those old kind of grease boards. It can be built directly into the TV, or it can be built as a standalone whiteboard that's always there. So just something to keep in mind as an aside. Now, the number one question I get about RTLS and other wearable tags, such as duress buttons, is the cost. Valley Hospital, which is profiled here, invested in an additional security measure for emergency department staff who are exposed to point of care violence more often than other staff. ED staff have the option to wear geo-tracking tags that can be easily and discreetly activated when needed. So these are like personal panic buttons that you wear on your person. If you push them, they activate a silent alarm, and that alerts a dispatcher of your exact location, including whatever room a staff member is in when calling for help. The big take home for Valley, as you can see here, is that their total avoided costs far outweighed the upfront investment required for the wearable tag system. So, if this is something you're thinking about investing in, I think the economics are in your favor here, and certainly, the opportunity to keep caregivers safer is a pretty good argument. Okay, so that takes us to the R in our framework, which stands for real-time emotional support. There's an interesting insight coming out of the research that we've done here on real-time emotional support, and that is that staff usually don't ask for help. We know this. Any idea what average employee assistance plan or EAP utilization rates are in the US? It's 3 to 5%. That's it. 3 to 5% of staff utilize their EAP. Why is that? Well, staff are too busy. They don't have time. They're, prioritizing their patient needs, and frankly, they're caregivers, which means they're terrible at asking for help themselves. We have this thing I call the "I'm fine" culture. We all know that. So really, the most important thing I want you to remember about this one is that you have to bring care to the caregiver. We can't wait for them to ask for help. Instead of waiting for staff to opt in to assistive programs, you've got to make them opt out only. Psychological first aid is a type of emotional support often used by disaster relief organizations. And on the right, you can see what it's not. This isn't critical incident debriefing or counseling. The goals of psychological first aid are to reduce initial stress caused by trauma, and enhance coping strategies and actively connect individuals with ongoing support services. It can also be used to, following a traumatic event, or really anytime the member of the care team needs emotional support. Now at Get Well, we are actively building real-time emotional support loops. So on the left, you can see a self-care loop that is designed for nurses by nurses. And on the right, psychological first aid delivered via loop as a post-incident check-in. So you can start to imagine all of the use cases here that we can build into technology to make this entire framework come alive. Okay, and so speaking of our framework, back to our framework, and that brings us to the final step, which is evaluate. Now the goal here is to analyze your data so that you can better anticipate future risk and be more prepared to proactively mitigate or prevent it altogether. I will say that AI holds tremendous promise here. And while it's not a current get well tool, it is an emerging technology that we should all have on our radar. You know, AI can use algorithms on historical data to recognize patterns, detect anomalies, and facilitate early identification of safety threats. Video analysis software can use existing video cameras and combined with AI can predict hazardous situations and use alerts to protect staff from incidents before they occur. So I think this is something we need to really be keeping our eye on the horizon. And then, as you know, GetWell does have digital rounding tools that provide back-end analytics to create transparency about patterns and opportunities to reduce the likelihood of incidents occurring and improving overall safety. And that takes us home. We've covered a lot of ground today. I've shared quite a lot of tactics and ideas. And you can see that whole framework again here. This to me is your tear-off sheet, to take away, use it as an auditing tool to ask yourself if you have systems in place to address each part of this framework. Now, before I get to QA, I do want to ask for your participation for a moment. If you've made it this far with me, if you've been listening along, I would love for your input, and this would actually help shape the work that we do moving forward so that we can understand what is most helpful to you. But I'd love for you to just take a moment to just consider, what is one thing that you learned today that you're going to consider doing differently to promote a safer environment in your workplace? And just take a moment and just type your answer into the question or chat bar. I know that you all won't be able to see it on your end, but this your kind of answer to this question will really help us understand where we want to take our further involvement, or when we think about evolving our technology to support you. And then what I'm going to do is, on my last slide here, I just want to open us up for questions. I'd love to hear or read your questions and comments. And I know it takes a couple of minutes to write them out, so I'm just going to pause for about 2 minutes and give you a chance to put them into the question bar. Thank you. I see a couple questions coming in. Okay, first question, I really like your framework. It's a great way to think about the problem, but a lot of this requires investment, and I honestly don't think CFOs really understand the extent of the issue at our hospital. How do leaders make the case for finding this? Yeah, that is a great question. I heard a story once about a CNO who had the exact same concern, and at that hospital, they made the decision to have all incidents, whether a near miss or not, all incidents of potential violence or aggression, they had a dashboard sent to everyone on the C-suite. I thought that was really thoughtful. In that story, she said it took about 2 weeks before they had whatever funding they needed from the executive team, what had been happening is the executives at that organization just didn't really understand the extent of the challenge. And there's a really good financial argument today as well, in a world where we have a labor shortage, and a lot of organizations have had turnover, have a high level of vacancies. This is a place where we should be investing in our people. So it's even easier to make that business case today. A great question, thank you. Another question here, we have our own language we use to communicate our safety policies. Could we build that language into GetWell systems? Yes, absolutely. GetWell systems, many of them are fully customizable, and we do have the ability to, in fact, that kindness pledge is not exact language, but it's language that is sort of loosely based on another hospital's own language that they devised themselves when they built that into their system. Great question, thank you. Okay, I'm going to ask, let's see, is there a link? Lori asks me, is there a link to use in the place of QR? We actually can send you a link in follow-up. So if anybody wants that link, we can send it. And then if you are interested in the slide deck, that is something that we are able to share as well. I'm happy to do so. Just either use this QR code or the link that we send in follow-up. And if there are no other questions, that concludes my formal remarks today. And I really appreciate having you all on the line with me. And I thank you for your time, and have a wonderful day.
All right, well, thank you, everyone. Thank you to our moderator and our presenter, and of course, our audience members. We hope to see you again at a future AMSIS event. You got the information to send to use the QR code there for slides and more information. If that QR code is not working for you, as we said, we'll share the link, or you can email directly membership@amsis.org, and we will forward that link that way as well. So thank you once again, and at this point, I'll ask my colleague Lori to please end the program.